Okay, good afternoon, everyone. I am very honored and pleased to introduce to you this luncheon panel. It's Issues in Economic Strengthening and Health Functioning Research for Children and Adolescents. And these are presentations from research centers. And I will introduce each of our distinguished panelists and then let them get up in turn, and then we'll have an opportunity to discuss with them what they are talking about. Our first discussant is Dr. Lindsay Stark. She's assistant professor at Mailman School for Public Health at Columbia University. Dr. Stark has more than a decade of experience leading applied research on protection of women and children in humanitarian settings. Dr. Stark's particular area of expertise is measuring difficult-to-measure social phenomena. She has led assessment and evaluation projects in Africa, Asia, and the Middle East, and is currently serving as principal investigator and executive director of the Child Protection and Crisis Learning Network, a consortium of agencies and academic institutions that work together on global learning associated with children in disaster and war settings. She holds a PhD and MPH in public health from Columbia University. Next, we have Dr. Funmi Olopade. She is the Walter L. Palmer Distinguished Service Professor of Medicine and Human Genetics, the Associate Dean of Global Health, and the Director at the Center for Clinical Cancer Genetics at the University of Chicago School of Medicine. Dr. Olopade is an expert in cancer risk assessment and individualized treatment for the most aggressive forms of breast cancer. She has developed novel management strategies based on an understanding of the altered genes in individual patients and stresses comprehensive risk-reducing strategies and prevention in high-risk populations, as well as earlier detection through advanced imaging technologies. Dr. Olopade graduated from the University of Ibadan Medical School in Nigeria. Next, we have Dr. Michael Sampson, Director of Research at the Economic Policy Research Institute in Cape Town, South Africa. Dr. Sampson has 25 years of experience in working in social protection. He specializes in designing, implementing, monitoring, and evaluating social cash transfer programs, recently completing policy design projects for social assistance programs in Malawi, Lesotho, Senegal, Ghana, Rwanda, and Kenya. He currently is working on social protection projects in Bangladesh, Indonesia, Mozambique, Nepal, the Pacific, South Africa, and Uganda. Dr. Sampson received his PhD in economics from Stanford University and his bachelor's degree in economics from Yale University. And last but not least, we have Ms. Lee Zhou, International Director at the Center for Social Development at Washington University in St. Louis, Missouri, where she leads the 5-year large-scale Youth Save project in Colombia, Ghana, Kenya, and Nepal. She has contributed to the center's consulting and research efforts on asset building policy and children's savings accounts for governments in China, Hong Kong, Indonesia, and South Korea. Ms. Zhou holds her MSW and MBA degrees from Washington University in St. Louis. Welcome all. Dr. Stark, would you?
Hi, everybody. I am going to keep this very brief because I think we've had a lot of presentations through the morning and it's lunchtime and people want to talk to one another and not necessarily hear more people talking. I'm also going to spare you slides and just share just a little bit about the CPC network, who we are, where we're working, what we're doing. This is really a network that I would invite all of you who are not already members or engaged in some way to check out, to consider participating in one of the many ways that there are to participate. The goal of the CPC network is really about garnering evidence around child protection programming, around effective efforts to prevent violence, abuse, exploitation, neglect, and to use that evidence base to drive forward better programs and better policies in countries around the world. We have a very small secretariat that is housed at the Program on Forced Migration and Health within Columbia University's School of Public Health. And we have a number of global level task forces and then country level program learning groups. So for those of you who were who participated in the session in here during the breakout session, you heard a little bit about one of our task forces and one of our program learning groups, and I'm just going to give you a brief overview on generally what those are and some of the activities that we're working on. So our global level task forces, we have 4 currently operating. The one that is most relevant and pertinent to this meeting is our task force on livelihoods and economic strengthening, and I'm sure it's going to come as a great shock to all of you to hear that Dr. Fred Ssewamala is one of the co-directors of that task force, along with Josh Chaffin from the Women's Refugee Commission. And our general model is to pair an academic with a practitioner to co-chair these task forces. So we're really trying to bring in both the practitioner lens and a strong research focus to drive our learning forward in the best and most culturally, contextually appropriate ways possible. So some of the activities, and I urge you to find either Fred and Josh or Josh and pick their brains a little bit more about all of the many activities that this task force is engaged in. But they've put forward a lot of global guidance. I think Josh brought some of the guidance documents with him, and where are they, Josh? They're over on that table. So collecting the learning around economic strengthening activities from practitioners all around the globe and offering some guidance for if you are looking to implement economic strengthening activities, how you can do so in ways that minimize harm and that will maximize benefits. A number of colleagues here at the University of Chicago are involved in a research study with the Women's Refugee Commission and trickle up to university in Kampala. So he can tell you all about some of our efforts in Uganda. I'm going to stop there, but we have a website, we have a newsletter, we have a Facebook page, we have many ways that you guys can get involved. It's a forum for you to be able to share your research and your learning. It's a forum to bring together, to meet other folks who are working on issues that you care about, and hopefully working together we can begin to continue to build better programs and to drive policy change forward for these issues. Thanks so much.